Hey friends, come on in, pull up a chair for another exciting, wonderful episode of Sharing with Friends on behalf of Sharing Down Syndrome Arizona. This month we are diving into the conversation of mental health and mental health support for those within the Down syndrome community. So we're super excited to chat with our friend Danielle Orr, who is a nurse practitioner and she's the owner of Three Arrows Mental Health, to really just dig into this conversation. Danielle, thank you so much for coming and being with us.
Thank you for having me. I'm excited to share my passion.
So first off, let's learn a little bit about Three Arrows. What is Three Arrows? Why is it called Three Arrows? Let's just tell us a little bit about your story.
So my background is I am a family nurse practitioner and a psychiatric mental health nurse practitioner, and I have been in the field working with kids for 25 years. And I just found that I needed to really create that passion into something that I really enjoy doing. Fast forward many, many years, I decided that I didn't want to work for somebody else and I wanted to work for myself because I knew that there was such a need and I could create a kind of care for patients that wasn't seen in a different, 15-minute appointment for a patient. And so I decided to create my own business. About 4 years ago, the name Three Arrows actually comes from my son who has Down syndrome himself. And the Three Arrows, the third trisomy 21, all the things. And our logo is actually rising up and moving forward. So that's something that as parents of a child with Down syndrome, we get kind of dealt crappy hands at times, and we just have to figure out how to move up and just kind of move forward. And that's just, you can't dwell on it. And that's where that came from. So started that about 4 years ago, and here we are.
And something that's very near and dear to your heart, we were talking a little bit earlier about it, is just that support, that mental health support, that wellness. Talk a little bit about that.
There's a lack of it. I mean, that's the biggest thing is there's individuals with Down syndrome or individuals even with intellectual disabilities. They're very misunderstood. And a lot of times, even with my own son, and we're going through our own journey right now, we've been told like, hey, how much do you think he actually understands? And how much, medically does he understand? Because he's had the gamut. He's had open heart surgery. He's actually currently fighting leukemia. And I actually had a mom ask me yesterday, how much of the medical stuff does your child actually understand? And I'm like, he understands a lot of it. And people don't really realize that he's just like any normal little 6-year-old. Yeah. And when we're talking about our kiddos, they think, oh, well, they don't understand. So we're just going to have to, not worry about them having anxiety or being sad or things along those lines. And I will tell you, I have been a huge advocate, especially with my son recently in our journey, to make sure that his mental health is okay. Yeah. And people can't just assume that they don't feel worried. They don't feel sad. They don't feel, angry or excited or any of the normal emotions that any individual would have. And it really made my eyes open because people are doing the same thing to my own child. And I'm seeing this in a way where I'm like, I really wish that we could explore that more. And so that's where it's very misunderstood. Right. And it doesn't matter the age. It can be anywhere from babies all the way through adults with Down syndrome. Yeah. They have feelings just like everybody else. They just may not be able to like express them in the same way.
Absolutely.
So that's where it's misunderstood.
And I think that's why we're so excited to just dive into this conversation, is to really shed a light on that and talk about that more, and talk about, how can parents with children that have Down syndrome, no matter the age, how can parents support them and really just, support their mental health and their overall well-being. So I guess that's the first question that we'll kind of jump into. For parents, again, no matter the age of your child, whether they're babies or adults with Down syndrome, what's some practical advice that you can give to parents to support their child when it comes to their mental health?
So always remember that your child is first and foremost. So if somebody's telling you that they shouldn't be feeling this way, or they're not going to feel that they're having a sad mood or a down mood or a worried mood, it may not look like the typical anxiety per se. It may not look like somebody who shakes or feels really worried or can tell you different things. They may have physical symptoms. And so the best way to support that is to really keep your consistency, keep your routines, keep your home a safe space where they know that they know kind of like what's expected of them, and to really just do check-ins with them. And if you notice that maybe they're acting a little bit different that day. And depending on their verbal ability, it's really hard because some of our kids are verbal and some of them are not. And so
Mm-hmm.
we have to really just kind of cue in. And I will say, I will always, always, always trust a mother's intuition and a father's intuition. As far as if they feel like their child is doing something different than their normal. And it's always like,
Mm-hmm.
what is their normal? What is Bobby's normal? What is Jody's normal? Like,
Right.
what is Susie's normal? Because you got to help support that piece. Because if you don't know what their normal is, you won't
Yeah.
be able to find the abnormal for them.
Yeah.
And it's not a blanket thing. So just making sure that there's consistency in their daily routine, doing, check and see if they're acting a little bit different. That's how you can kind of
Yeah.
make sure that you're supporting them and also preparing them. Like,
Mm-hmm.
hey, we're gonna go do this today, but don't tell them the whole entire day. Give them a short little snippet of the day. Hey, we're gonna go do this first. And then after that, okay, we're gonna go do this. So that they have some time to process and don't feel overwhelmed about what they're gonna be doing at 4 o'clock this afternoon
Yeah.
at 9 o'clock in the morning. Because that's not gonna get you very far when you're
And
trying to
that's,
do things.
yeah, exactly. And that's such a great tip too, because every child is unique and
Mm-hmm.
different, right? But as a parent, like you said, you just know your child.
Yeah.
So really just following that intuition, just really trusting yourself and going with that. So let's talk a little bit about what are some signs for that a child or an adult with Down syndrome might be dealing with anxiousness or
Mm-hmm.
depression. What are some things that parents should be looking out for when it comes to those things?
So I love this question because I get it all the time. Doesn't matter if the individual that I'm treating has Down syndrome or is neurotypical. And it's one of those things where parents, again, just think that somebody should be acting shaky or really sad or crying a lot. There's a lot of physical symptoms for anxiety that people just don't realize.
Mm,
So some of them might be nausea, vomiting, avoidance, anger. So if they're getting angry about something and they don't want to do it, and you're like, whoa, like, why are you yelling at me right now?
mm-hmm.
Or why are you grunting at me? Or why are you, just being
Yeah.
aggressive? And those can be really big signs of anxiety, or diarrhea, or just not wanting to eat maybe when they
Mm-hmm.
typically do. Some other physical symptoms can be like licking of their lips, picking at their nails and their cuticles. I have so many kiddos that I see that just
Wow.
pick so much at their little cuticles, especially like when school's starting in
Yeah.
the school age kiddos, or like a new day program or things like that. Those are the physical symptoms as far as the anxiety piece goes. Things to watch out for. The depression, again, can be just kind of like not wanting to come out of their room, not wanting to get out of bed. Maybe they're regressing in their behavior. Maybe they, used to be potty trained and now they're not. Maybe they used to enjoy doing a sport or an activity with family members and they don't want to do those things anymore.
Mm-hmm.
They're very similar in, like I said, in a neurotypical kiddo, but parents don't really realize that because they're like, well, they're not verbalizing. That doesn't matter. There's 1,000 things you can pick up on a kiddo any age without being like the nonverbal communication is huge. So you just have to be in tune with it.
So let's take it a step further then. Once you're in tune with it and you are
Mm-hmm.
noticing, let's say you are noticing some signs or symptoms that your child might be experiencing, signs of depression or anxiety. What's the next step? What should a parent do after that?
Sure. So anytime, I always say, if you're noticing these things, keep a closer eye on them. Make sure that you are creating a safe environment for them, regardless of who the child is. Wanting to make sure they don't have access to potential things that could hurt them. Are they being safe in the car? Are they wearing seatbelts? Are they, are there a bunch of medicines or pills out, which is things like that. And that's something that it doesn't matter the age of the child or the developmental like ability of the child. You don't want to have things like that. Just making sure that they don't have things like maybe they're interested in fire or keeping make sure they don't have lighters or things like that in their room just to keep things safe. And then the next step would be just really checking in with them and just seeing how they are doing, see if they're able to communicate with you and tell you like, yeah, they're doing good, or no, they're having a hard time. And if they are having a hard time, talking to their pediatrician or their primary care physician. And from there, if they're not able to help you, which most of the time, I'll be honest, they're at a loss and they're like, oh, it's fine, they'll just get over it, it's just a season, things like that. Then if that's the case, then you probably need to reach out to a mental health professional. And really somebody that specializes in somebody with neurodivergence, somebody that has IDD, things along those lines. Because if you go to just a lot of times I will tell you a basic psych eval, they're not going to know what they're looking at or looking for, and they're just like, well, I don't really know, you need to go see a specialist. But you don't always need to go see like a developmental pediatrician when you're dealing with anxiety, depression, because it's going to take you 2 years to get in to see them. Like they take forever to get into. So just making sure that you're checking with them and keeping them safe. And that's the next step, would be to make sure that you're addressing what's going on. And a lot of times you can address it at home. Maybe they're just in a funk. Maybe they just need to get out and get some fresh air. You know, it's
Yeah.
sometimes some sunshine will just do wonders on
Mm.
your mental health. So
Absolutely.
yeah, little things.
Yeah. Little things, but that are really big things and that
Correct.
really add
Yeah.
up and make a difference.
Yeah.
So let's shift the conversation a little bit to adults with Down syndrome and just talking about setting healthy boundaries in relationships, whether that's friendships or romantic relationships. What is your thoughts? What are your thoughts on that?
It's never too early for any individual to learn good boundaries. So I think having that conversation, even in teenage years, prior to, you know, puberty and hormones, it's important to start having those conversations, especially romantically, because we want to make sure they're safe boundaries. So they know that, you know, unfortunately, the statistics show and support that individuals do get mistreated, and they do potentially get more, they're more likely to be harmed. And we want to make sure that we're giving them boundaries to know, like, hey, this is my body. I'm not going to be sharing that. Nobody's allowed to touch me or do these things that I'm not comfortable with. So that's really important with the romantic part, but also the friendship part, and reminding them of, you know, if your friend isn't being nice, and you can use whatever terms you want, or kind, or whatever different, you know, words you use in your house, that maybe that's not a good friend to have. And you want them, if they make you sad, do they make you happy? How do they make you feel? If they don't make you feel happy, then maybe we need to set those boundaries and say, maybe we should play with somebody else or hang out with somebody else. Or there's, you know, there is a lot of drama in any of our teenage, young adult arena. Doesn't matter, you know, what's going on. I actually work a lot with individuals that have gone to Tyler's place, and there I hear a lot of drama that's, you know, the teenage things there, and the young adults. So it's one of those things where just having those connections and support, and sometimes you do have to end up talking to the adult's parent, just so that you can kind of, like, you know, make sure that you're all on the same page, because again, verbal abilities are different, but making sure that you are using words that your child is familiar with, adult child is familiar with, so they know what's good and what is bad.
Yeah, I love that. So let's expand a little bit on the conversation around romantic relationships. So Teresa and I were kind of chatting about this the other day when it comes to romantic relationships. And, you know, for parents, sometimes talking about sexual health can feel tricky. They don't know where to begin, or how to verbalize it, or how to communicate it in the right way. So when is the right, and you kind of touch on this a little bit, but if you can maybe add to it, when's the right time to start that conversation with an adult with Down syndrome relating to that piece?
Now. Always early. So there's a couple of things that I always recommend, especially when you're dealing with somebody who may have a limited verbal ability, and it is using correct words for things. If we're using acronyms or nicknames or different things like that, it's something that can create potentially issues as time goes on. Or if something was to happen to them, if they have a nickname for something, a body part, it may end up not being understood later in life, if they're trying to say that they got hurt on, you know, their boo-boo, but really their boo-boo is not like an arm, it's something else. It's a private part. And so really having that conversation now, having good boundaries, and just talking about and using anatomically correct words. And I know a lot of parents are uncomfortable with that. I understand that, but the earlier that you can do that with any individual is going to be important, because you want them to understand that they need to, you know, keep things healthy and their body healthy, and just respect their body. And so start now. Like, it's important to have those conversations young. And even if you haven't had them yet, that's okay. You can start and have those, you know, healthy boundary conversations. And it doesn't have to be all at once. It can just be little bits at a time too. So that,
like little bits and pieces.
So you as a parent aren't like, oh my gosh, like, it's overwhelming for me too. Because a lot of parents are not comfortable with talking about that. So
no, it can feel overwhelming, I feel like, as a parent, because it's like, oh my gosh, where do I start? Do I say the right thing? Am I going to say the wrong thing? So really, I like your tip about kind of like bits and pieces. It's okay to break it up.
Yes, for sure. And I think parents need to do that. And if, as a parent, you don't want to give them the whole, like, Reader's Digest version. Like, you don't want to give them the whole entire book of things, right? Because if you do that too, you're going to lose their interest. I mean, let's be honest, like, our kiddos just don't have interest in things for a very long time. I don't half the time have interest in things for a very long time. So it's really important to do it just in little bits, and things that you're comfortable with. and obviously the other thing that we're talking about health, but even, our menstrual cycles, things like that is
Right.
it's something that I have a lot of parents that are very uncomfortable with talking to their kid about. And I give them other options of like, ways to kind of help with that, because that's a whole nother like hygiene issue.
Mm-hmm.
But they worry about that. And thankfully, there are some specialists in the Valley that really do specialize in that. But it's one of those things where you need to help prepare your child, because adult child, because again, periods can come at different times, but
Right.
that's something that can be very scary.
Yeah.
And so having that conversation, or even with boys, having that conversation of things that can happen to our bodies is
Mm-hmm.
important. So they're not
Mm-hmm.
like, oh my gosh, what's going
Like,
on with
what's
me?
happening?
Yeah. Yeah. And so earlier is
Yeah.
always better.
Yeah.
And
Of
again, if you
course.
haven't started yet, there's nothing wrong with that. Start now and just, talk about the things.
Yeah.
So
You're giving such awesome, amazing tips. This is so, so, so good. And I know some of it might be overlapping, but I feel like as we're just digging deeper into this conversation, you're just going to continue to just give such great nuggets.
I'll pull it out of the filing
Yay.
cabinet somewhere in there.
No, so this is good. So let's talk about self-esteem and just
Yeah.
confidence overall.
Love this
What are
question.
some things that parents can do to help their kiddos with Down syndrome just feel more confident about
Yeah.
themselves?
Love this question. So, uh, affirmations. This is my big thing. We do this in our house. Love this. And I do this even with my own patients, of just daily affirmations. And we will say, before, I've been doing this with my kids, since they were since they were babies. And just when we repeat the same things, like, you are brave, you are strong, you are kind, you are beautiful, or in my son's case, you are handsome.
Mm-hmm.
I always, because I have a daughter too. And you are light, and you are loved, and you are, insert your child's name. So like my son's name is Joey, for example. And I love that, because it's something that and I will tell you, like with my son's recent cancer journey, we have carried that with us in the last 4 months in the hospital, where we've had some really bad, really rough days. And we just remind him, you are brave. And he's to the point where he will tell you, like, I am brave. And he'll, in his own way. And sometimes it's just, I am, strong, and just using like our, his own made up sign language is what I call it.
Mm-hmm.
But just really reminding your kiddos that you are worthy, and using those positive affirmations are huge, because if they're not hearing it from you, where are they hearing it from? And you need to start that very, very young. And again, if you haven't started, it's totally fine. Again, my background is in pediatrics, so I'm always going to default to that. But as far as that goes, like, if you start now with your adult child and telling them, like, hey, you are amazing, and you are brave, and you are beautiful, and you are handsome, those are things that are going to carry them along, because they're going to say, you're right, like, I am, and I'm going to feel this way about myself, because you want to make sure that they feel good. And giving them positive reinforcement is huge with any individual. Mm-hmm. So that's also super helpful.
I love that tip so much. Just that those affirmations, that positive self-talk. Mm-hmm. Because really, if you think about it, right, like, as you're speaking life into other people, you're really speaking it over yourself as well. So not only are you going to feed that into your child, but you're going to continue to really, truly believe that about yourself too. Yeah. So it's a win-win for your whole family.
I mean, I may have reminded myself that I am brave a couple times in the last couple of months, but it is. If you sit there and you feed it into the world, it's going to become your reality, and that's really important.
Absolutely. Yeah. So Danielle, talk to us a little bit about just everyday practical things that families can do at home to support not only mental health, but safety in general for their kiddos.
Sure. I love this question also, because I get it a lot, and I really do a lot of education when I'm in my office with parents, because I mean, I treat neurotypical kiddos, but I also, my near and dear is my kiddos with Down syndrome, autism, intellectual disabilities, cerebral palsy, like everything. It's my passion. So the biggest thing is, if we're talking mental health, I'll kind of break it down a little bit. Mental health wise, if you have a kiddo that is maybe a runner, or is hurting themselves potentially, and I'm not saying that our kiddos are, but just in general, really just making sure that there's not the sharp things in their rooms, or they're not having access to stuff, or the curiosity sometimes is just the things that our kids just get really impulsive and very curious, and so just making sure that we don't have those opportunities for them there is going to be the biggest thing. But also on the runner side is making sure that you have like door alarms. In my house, everyone laughs at me in my house, because we are literally like Fort Knox. We have an alarm that anytime an exterior door opens, it says what door opens. And it used to, I mean, it drives people crazy when they come over, but I don't really care, because my little guy is a runner. He loves to run out the door, and it helps me feel safer, the knowing that I can hear where he's at. even across the hallway,
Yeah.
across the room, across the house. Um, it makes me feel safer in that respect. The other thing is making sure that we're doing check-ins, like even with their schools, if they're in a school or in a day program, making sure that you're doing check-ins, and if they're having a lower mood, that you've got that open communication with those individuals that are working closely with your child throughout the day, and whether that be in a day program or in a school program, to see if there's any changes in how their behavior is. And lastly, also making sure that we are alerting your local police department. You can call the non-emergency number. You can get your kiddo to wear like a bracelet band, especially if they're nonverbal or even if they have a dual diagnosis of autism. But I'll be honest, sensory wise, most kids won't wear them. But you can have your local police department put an alert on your address that shows that maybe have a nonverbal child there, or a child with autism, or a very anxious child, just so that the police department, the fire department,
Mm-hmm.
all know going into that it may be an adult that has a limited verbal ability but looks like this rough and tumble person, and they may think that they're being aggressive,
Yeah.
but they're really not. They just are very anxious and they can't tell you what's going on.
Mm-hmm.
I used to work with the fire department closely many, many years ago, and there were many times that we would see those alerts pop up, and it was so helpful because we knew
Yeah.
kind of like what to expect. So
Yeah.
those are the biggest things that I would say. Just check-ins, making sure that you're keeping your home environment safe, and then alerting those that are around you, and even your neighbors would be a good idea. Have your neighbors' phone numbers. um, if you're not, if for some reason your child is home or their caregiver isn't answering your phone call, you can call a neighbor up and say, hey, can you go check on them and see what's kind of
Mm-hmm.
going on. So all of those things, like to have layers of lifelines in
Yeah.
there, is important.
And Danielle, I just love the tip too about alerting your local police, because that's important.
Mm-hmm.
And I feel like sometimes parents may not always think about things,
Mm-hmm.
like that.
Yeah.
So I love that you included that. And just a general safety, just safety tips too.
Yeah, for sure. And those are super important. I mean, I could even go down the gamut of, if your adult child or a younger child is on oxygen, alerting
Yeah.
the power company, so that they know to turn your
Oh,
oxygen or your power back on first. Yeah, they put a
wow.
red alert. Actually, I know this because this
That
happened
is
with our
so
son. He was on
good.
oxygen, and we had like a red box. And so everybody in our neighborhood loved us because our power always came on but early before everybody else did in a power outage, because our whole neighborhood came
Okay.
back on. But you get a letter from your doctor that they're on oxygen, or needing to have power
Mm-hmm.
all the time. And so there's little tidbits that a lot of parents don't know.
Wow.
I didn't know it either. And I've
Yeah.
had to kind of learn this along the ways and just help guide my patients and their
Yeah.
families, because there's so much out there that is not widely known, and we just have to find out about it.
Yeah.
And it's so frustrating. So
Yeah.
anytime that you can alert those around you and help that village get more expansive for
Yeah.
your child, is going to be helpful.
Yeah, more support, more
Mhm.
communication, more
Yeah.
connection, more
Yeah.
partnership. And that's why I think too this is so important, even sharing with friends, is because we have these conversations, these really important conversations with experts who can help support those within the Down syndrome community and families as a whole. So we just love all the tips that you've been sharing and just
Yeah.
your expert advice. So we touched a little bit on this earlier, how everybody, of course, everyone's different. Everybody expresses emotions
Mhm.
differently. So, what are some ways that families can help their loved ones just express those deep, maybe big feelings, those emotions, maybe how to even cope with stress? Any tips there?
Sure. So again, knowing your child's baseline at any age is really important. So knowing that they don't typically bite their nails, they don't typically get angry, or they're not, like, my son likes to be very stubborn, for example. He's not feeling super fantastic today, and even just trying to change his pants earlier because he's not potty trained yet, the absolute leg crossing, not wanting to get up in defiance this morning was super hardcore with him. And I'm like, what is going on? Well, he doesn't feel great. And but he just doesn't want to do anything. And so knowing what your child's baseline, I'm like, oh yeah, like he's just not feeling good today. Let's figure out a way to kind of go around
Yeah.
that. Maybe they are not sleeping great. Maybe they're usually great sleepers, and all of a sudden they're tossing and turning all night long, or they wake up and they've got really dark circled, bags under their eyes,
Mm-hmm.
because you just can tell they're not feeling super great. Maybe they're really worried, because a lot of times sleep disturbance is actually a very common thing with depression and anxiety. A lot of people think that with depression you sleep all the time. That's actually not true. A lot of times it can cause sleep disturbance too. And so just noticing those little baselines for your child is going to be super important, and really kind of being able to pick up on like what's different with them, because it's going to look different with everybody.
Yeah,
So
absolutely. And this is such an important conversation, right? To have not only this month or next month or the month after, but year round.
Mm-hmm.
Like this is a year round conversation when it comes to supporting mental health, mental well-being
Mm-hmm.
for our kiddos and for our families as a whole. So do you have any final tips, advice to leave with parents when it comes, I mean, you've given so much already, just it's been so amazing, but any final tips that you can leave parents with on just supporting your kids, supporting mental health, supporting mental wellness
Yeah.
overall?
So this is going to sound one of those easy, but not really, many people do it.
Mm-hmm.
Exercise, sunlight, and proper nutrition is huge. I know our kids are picky eaters, 100%. I'm going to agree with you on that one. But trying to create and hide in different things that we can.
Yeah.
I am the master of hiding vegetables in things,
Yeah.
and trying to keep them more sensorily appropriate and
Yeah.
palate appeasing. But just making sure our kids are getting outside and getting connected, putting their feet in grass, like just bare feet in grass for 5 minutes, can do the biggest reset for their emotions.
Wow.
It's huge. My son, who's been hospitalized for the last literally 4 months, he was out back like a week ago. We're home right now, and he took his shoes off and he sat in the grass, and you could literally see the calm just come over
Yeah.
him. It was the coolest thing to see, because I always preach it to my patients, and
Yeah.
just go outside and ground. It's called grounding
Grounding.
techniques.
Yeah, I heard about.
Yeah,
Yeah.
and it's not that you're grounded like you're in trouble. It's
Right.
just getting yourself. I mean, if you don't have grass, I mean, we have fake grass and that still worked. But if you don't have grass, you can use like a fuzzy carpet, like a not something that's got a little more texture to it, just to kind of get that feeling under your feet. Getting sunlight on your face first thing in the morning is also super great for any individual. And thankfully here we don't have to worry about like a seasonal depression as much in Arizona. We can worry about more like a summer depression because it's hot outside.
Yeah.
But getting in touch with those things is really important. And then making sure that our kids and our adults are drinking plenty of water. And I know that's a struggle sometimes, but those, and just making sure that they're feeling good inside, because they can't always tell us how they're feeling. And it may be a simple fix of just getting them outside, getting them moving, having them help you take the dog for a walk, just to kind of reset them. Or
I
listen to
love
music. We love
that.
dance parties in our house. Like that is an instant reset of anything.
Yeah.
My son thinks it's hilarious when I do different dances with him.
Just to lift the mood. It just brings
Yes.
something different.
Yes.
We actually spoke with a pediatrician last month, Dr. Maggie Keene, and she was
Love her.
talking about those exact things: the exercise, the sunlight, the nutrition piece of it too. And those might seem like simple things, but they're actually, again, we touched on this earlier, simple things actually sometimes are the really big things.
And sometimes the hardest to accomplish.
Yeah.
Because it's not a routine that you're in.
Yeah.
And it's hard. And I even fight with my daughter on this, about getting our vitamins and getting our exercise and things like that, because I know she's better and less grumpy, and she has ADHD. So she's less busy and unfocused and impulsive if I get her outside to play for a few minutes. And even my husband's like, I don't believe it. And then he'll go, oh, like there is a huge difference like in it. So, just that little bit of moving your body, especially before bedtime too. I will say that if your kiddo, doesn't matter their age, struggles with sleep, getting them to move their body for about 10 to 15 minutes, about an hour before sleep, can actually help just get your body ready to reset. And so moving their body, whether that be, I mean, in all different levels, it can be just like outside walking the dog. It can be a quick dance party. It can be pushing something heavy around the house to get that proprioceptor and input.
Yeah.
We like to do laundry baskets in our house and push heavy things or Amazon boxes, and just doing those things can actually help get them ready for bed. And routine. I don't care how old your child is. Babies thrive on routine. Elderly thrive on routine. Everybody individually does in between too. So when my routine's off,
you can feel it. Like you notice when the routine is off.
So everybody thrives. So those are my little tidbits is just general well-being.
You've given such great, amazing tips.
Thank you.
Love it so much. So let's say if there are families who are here locally, how can they get in touch with you and Three Arrows Mental Health?
Sure. So you can literally Google me, Danielle Orr. My last name is ORR, which I know earns like, how do you spell it? Or 3arrowsmentalhealth.com. Is my website. And we're in Gilbert, Arizona. I also do the functional side of things, so more in depth looking at like diet and nutrition and those kind of things, which I can do remotely and telehealth. So it's not actually that I'm your provider. I'm more of coaching in that role. And so I can do that across the US. So I have that. That's actually 3 Arrows Functional Psychiatry. Again, just you can always reach out to me. personally answer all of my own emails if you come through the website, so you can get a hold of me. If I am not able to answer, I'll have my assistant answer, but I read every single email that comes through. So you can just get a hold of us that way.
And we're going to link all of Danielle's information in the description of the interview, so you'll be able to get connected with her. But you've been a joy. You've been amazing. Thank you so much for just all your knowledge and all your tips and your heart and your passion. And we wish you nothing but the best.
Thank you. I enjoyed being here today. Thank you.
And friends, thank you for joining us for another episode of Sharing with Friends on behalf of Sharing Down Syndrome Arizona. We invite you to keep plugging in, share, subscribe, like, all the things as we continue to have these very important, insightful conversations with our community. We'll see you next time.